Hi, myself Raj, and welcome to my channel, I'm here to talk. Today I'm going to start Health Talks episode number 7 with Shawn Baker on the carnivore diet. Well, I do not think I need to introduce this person because you just need to type Shawn Baker on Google and you will get ample amount of information that who is he and what he does. Well, whenever we talk about the carnivore diet, this name of this person, Shawn Baker, comes in our mind first because he is the epitome of this diet. The lifestyle that he's living, the workout that he does on a regular basis, the physical training that he does, that is really, blow my mind. And if you check his Instagram channel, you'll be blown out. So, the matter of fact, it would be an honor for me to have him online because I believe this entire conversation on the carnivore diet with him, with Shawn Baker, would be great, amazing. So I really do not want to waste much time. I just really want to have him. I'm really excited. I'm looking forward to have a great discussion, but you have to make sure you are not skipping any of the seconds of this particular video. You're watching this video till the end to have the real information, because this video will be really beneficial for the people, those who are actually suffering through pathophysiological situations because of the wrong nutrition, and believe this video will really help them. So we have to share this video as much as possible. It's our duty. So without wasting much time, let's start today's Health Talks episode number 7, the carnivore diet with Shawn Baker.
So finally we are here. I have Shawn Baker with me, and thank you so much, Shawn, for accepting this invitation. First of all, it's an honor for me to have you.
It's truly, the pleasure is truly mine. It's nice to talk to a very different audience than I'm used to talking to. So it's good to be able to reach people in different parts of the world. So thanks for having me on. Appreciate it.
First of all, it's a big time for me that you accepted the invitation, and I believe that through this podcast, people will have a lot of immense of knowledge about this carnivore diet and the efficacy of the high protein diet. I believe that. So without wasting much time, I would like to ask you a few questions, so to have a better, overall understanding about this diet. So number one, why do you believe the carnivore diet is the quintessence of food habit?
Well, I think that, obviously humans eat a very varied diet currently. Currently we have a much different diet than we might have had, doesn't matter what part of the world, even in India or the Indus Valley. If you go back a few hundred years or even, a few thousand years or perhaps farther than that, our diet is much different than it used to be. And I think it's pretty clear that throughout the world, including a place where vegetarianism is so common as in India today, meat was a very important part and crucial part of the human diet. That is, I think a universal truth. I think that a lot of the foods we eat in the modern diet we're just not designed to handle very well. So I think most of disease, it can be tied back to nutrition. I think that's a fair statement. I don't think too many people would disagree. At least some people may argue about the relative effect, but I think it's a pretty big effect. And I've seen some incredibly powerful disease transformations by putting people on appropriate diets. Meat is extremely well tolerated. Our system is uniquely and very well designed to handle meat. I mean, I think it drove sort of part of our human evolution. If you sort of believe in or understand an evolutionary background for human development, then that becomes pretty clear. But besides the theoretical things, because you can talk about what people ate 1,000 years ago, but we can't really confirm that absolutely without a time travel machine, which none of us have yet. But really what I'm seeing today is people going on a meat-based diet, and that's very, very unusual. Most people think it's you should be on a plant-based diet or something along those lines, and so not many people have been willing to do that. Although if you look back historically, at least going back to say the 1700s, physicians have been instituting this for various different maladies, and a lot of times it's been with diabetes in particular, with great success. And so there's all kinds of literature in the Western world, and I don't know, I'm unable to, access or interpret the Eastern stuff, but I mean, there's probably examples of that going back then as well. But we're seeing, and I'm seeing, basically thousands of people, just resolving all types of issues, whether it's obesity, diabetes, hypertension, heart disease, autoimmune issues, gut issues, which are becoming so increasingly common throughout the world, they all get better. Mental health issues, depression,
Yes,
anxiety, all
exactly.
those things improve.
But still, people have this misconception about this carnivore diet. Means like because of the lot of confusing articles over the internet, they search it on Google and they get a lot of confusion in their mind. Means like as you said, it's inherently we have these overall fundamentals to connect with the high protein diet, to react with the in a very good way this high protein diet. But still, people do not accept it. Means like it's kind of contradictory thoughts, isn't it?
Well, there's a lot of people that would certainly look at the sort of modern nutritional evidence, and unfortunately, the evidence that's out there is not particularly strong. It's very, very difficult to do human studies that are long lasting, that actually look at endpoints, and when you really control what people do. The best we can do, some people will say, is this sort of epidemiology, where we'll just ask people, what did you eat last year? And
Right.
most people don't really remember. They aren't accurate. And even if
Exactly.
sometimes they'll kind of fudge the questions, because they'll say, well, I didn't eat that much sugar. I really ate more fruits and vegetables, so that we know those numbers aren't accurate. And so that is where we what we do, looking into saying what we're supposed to eat. And so those have been shown over and over again. And, really some of the more recent studies have come out. Really, I mean, the Journal of American College of Cardiology 2020 position paper saying, hey, red meat, dairy fat, butter,
Right. Saturated
chocolate
fat. Yes, exactly.
are not problematic. There's been other studies, Nutrix came out in 2019 saying red meat does not cause cancer, does not cause heart disease. I mean, these are huge systemic reviews by well-respected researchers. And so we're seeing this big shift. However, we have unfortunately a huge conflict of interest with the food industry. They want to continue to have you continue to purchase really cheap food that is highly profitable.
Right.
I mean, it's been great. Our grain-based dietary system has been wonderful for feeding a lot of people, and doing so very cheaply. Unfortunately, it has not done much for individual health. I mean, it's allowed populations to not, to be able to feed themselves, but the individual suffers. And I think that's what we're seeing.
Sooner or later, they
over.
have to invest the money. Right now, they are, trying, thinking that way. Okay, we are actually spending a little bit lesser money for the food, but sooner or later, they have to invest the money on the medicine in the future if they are not taking care of the health
Sure,
right now.
that analogy holds up. Yeah, you can save a nickel now and pay $1 later, or I don't know what the appropriate analogy is for rupees and stuff, but that sort of line of reasoning holds true to not only to an individual, but also to countries and populations, because if you don't address this chronic health disease, it becomes incredibly costly. The United States spends $3.5 trillion a year on chronic health disease, and we're not making any headway. And India is not far behind. They're going to be, as you probably are aware, you're seeing increasing, epidemics of diabetics and obesity and heart disease are ravaging India. And it's just because, as you can see, your food has shifted from traditional things with traditional fats, things like ghee and butter and dairy, and now we're seeing more and more of different oils come in. I think it's maybe safflower or sunflower or palm oil or canola oil or something's replacing that. And then all the refined grains and sugars are taking over. And that is just a recipe for a complete disaster.
Right. So my second question is high protein or carnivore diet is healthy for kidneys? It's like, I know that, but the people, it's like whenever I observe that they get to hear it's a high protein diet, it's better for the overall health, the first question that comes into their mind that whether it's healthy for the kidneys or not, because there are a lot of confusion they have, regarding this protein and the renal function connection. So please, tell us something about this.
Sure. First of all, you are correct in that it is a higher protein diet, although it still tends to be relatively higher fat as well, because I think most people will get around, on average, about 30% of their calories from protein on a meat-based diet. The average, and I can speak to the American data, I'm not sure what it is where you are, but the average American usually gets about 12 to 15% of its calories from protein. So we basically double that or a little bit more on this diet. So it is higher protein. There are people that eat even higher protein diets, which, are harder to sustain in my view. There's been a misconception, for several decades that protein is harmful for the kidneys. There was a Dr. Brenner back in, I believe, the 1980s who did some studies on animals, particularly mice and rats. And he saw that those animals, when subjected to higher levels of protein, would sustain some damage to their kidneys. However, that has never been shown and been extrapolated to humans. What we do see is when people go into renal failure, when their kidneys do fail, they tend to spill more protein. But that's not because the protein was damaging it. It's just that the kidneys are no longer now able to filter the protein. So there's a concept that more protein is going to cause the kidneys to work harder. That's also, the analogy for that is, and there's a nice meta-analysis review article that Stu Phillips, who's one of the leading protein researchers in the world, put out in 2018 looking at this, and I've got it on our website. We can link to it later. But basically the result of that massive systematic wide review of all the data around protein and kidney function is there's no evidence that higher protein diets harms the kidneys in any way, shape, or form. I have personally seen people going on this diet and actually improve kidney function. I've got, nephrologists. I just interviewed a nephrologist the other day who's seen similar and comments the same way. Now, the problem is, when we talk about, well, there's more, the kidney does more work when it's challenged with more protein. That's kind of like saying your heart does more work when you exercise. Your muscles do more work when you exercise, and therefore we should avoid exercise, which most people would say that, that does. There's a few people that think exercise is bad for everybody. I'd say they're in the minority. So it's not problematic to eat protein on a diet for a healthy person. And I would go so far as to say that even people with unhealthy kidneys generally can benefit from not necessarily a high protein diet, but a diet that is devoid of refined grains, sugars, industrial oils, and a carnivore diet does that. So when you remove all these truly damaging compounds from the diet, you actually see improvement. It's not that the protein is either harming or not harming the kidneys. It's just removal of all the, the sugars and all these things that really seems to help.
So my third question: does high saturated fat content of carnivore diet induce CVDs? This kind of high saturated fat content, does it affect overall arteries blockage problems or heart problem that induce that? What do you think?
Yeah, that's a really complicated question and a very nuanced question. So certainly, so if I take, most red meat, and I'll use the example of perhaps lamb, because that's probably more appropriate, mutton or something like that. The majority of that fat is going to be monounsaturated fat, slightly more than saturated fat. So there is, most people don't realize that most of the animal products contain just as much monounsaturated fat or perhaps more than saturated fat. Nobody hears about how great monounsaturated fat is, and they talk about olive oil in the Mediterranean diet. But in truth, saturated fat is the second most common. Saturated fat is it's just not one thing. There are many saturated fats. There's, small chain, medium chain, long chain, and it can be from anything from propionate, butyrate, which we hear about these short chain fatty acids, which are saturated. It can be caprylic, caproic, linoleic, palmitic, and stearic acid. All these things have differential effects on the way the body works and how it seems to do. What I would say is that I don't think that saturated fat by itself in the context of normal caloric consumption is inherently dangerous. And I don't think there's any evidence that would show that. Now, when you overconsume something, and that's kind of a bit of a tautological argument, because once you say overconsume, you're automatically implying bad things happen.
Exactly, right.
So if you do, eat more than you need, yes, it can be problematic. Just like if you eat too much grain or if you eat too much calories, it can be problematic. The issue is, and particularly in the context of a carnivore-based diet, most people don't overeat because of the profound satiety effect you get. That is to say, most people get leaner, they become more muscular, they don't tend to eat to excess. Now, it's the opposite occurs when you eat these highly refined, highly palatable foods. These sweets and treats, and our body was not designed to ingest.
If you think about the satiety means the matter of fact with the satiety. It means high in the carnivore diet, people actually, even if they try, they will not have that, the craving to eat more food, that which actually happens in the grain-based food, the high carbohydrate-based food, because people do not understand how much to eat and when to stop and when to not, because our body get basically confused in the high carbohydrate, right? Isn't it?
That's true. I think there's satiety plays a huge role. I mean, some people say it's all about calories, how much you take in versus how much you expend. And certainly you can say that there's reasons to say that's true, but the problem is, how do you regulate that? How do you control that? And for most people, it has to do with appetite. You might say, I'll eat whatever I want and then I'll run all day long. Well, that's not practical for most people. And it's just kind of a waste of a life. So when you're able to eat to satiety, and I liken, humans as an odd species because we're the only ones out there, at least in the wild, that can't seem to control our body weight. We don't see, obese wild animals. They tend to eat, even when they have access to all the food they need. They don't get obese because they eat what they're supposed to eat. And humans
They're eating the right nutrition, and we are the species that we are so much confused about our nutrition paradigm.
Yeah, we figured out how to make our own food, and we're just unfortunately we made the wrong food, unfortunately. And I think this goes back to the concentration of energy. When you start refining things, when you start refining grains, when I chew something, like I chew a piece of meat, or maybe I don't do this anymore, but if I were to chew a vegetable, I can only chew it up so little. I mean, it's still relatively in big pieces, and my body has to slowly take that apart through the digestive system. There's a slow, long route, and it goes in a sequence. But when you've ground everything up into a fine dust, you've got such a quick absorption pattern. It is not the normal absorption pattern. There's something called these incretin hormones that affect they are
Got it.
what we eat affects those things. And so
Exactly.
if they get out of order, if they're stimulated too quickly, then we have problems. We have these metabolic problems that occur. And so I think the ultra processing of food is a huge, huge problem. Meat is very difficult to do that. I mean, it's, most people don't eat meat powder. I mean, it just doesn't, it doesn't really work, and so you'd rather have it, as a, like I said, you might have chicken, maybe some sauce on there, or,
Yes, exactly. It was funny that to have, to hear this, meat powder.
There's some people that ask about that, but it's kind of,
I mean, it's like just using the whey protein supplement just to alternate the supplement. They want to have the meat powder as well.
Sort of, yeah. And I think people ask me often about whey protein. And I think, if you're really struggling to get protein in, then that's a reasonable source of protein. However, you got to remember the absorption pattern of whey protein is very different than what you get from food. And so some people, whey protein can be a problem. I think it's a problem for people, particularly people that are diabetic. I think those folks can struggle with that because it's, again, the absorption profile is so quick. But I tell people, if you can eat meat, you're better off.
So that means you want to tell means like for the people, those who are actually diabetic, and if that person is actually trying to have a better lifestyle, for that person, whey protein, there are a lot of versions come, means like isolate version, hydrolyzed version, means like it's not beneficial for them.
I'd say that there's some limited benefits for it. Again, I think protein in general is a good thing. I think the benefits of protein are pretty significant. We want to make sure we maintain lean functional muscle mass, bone mass, organ mass. All those things depend on protein intake being adequate. The definition of adequate varies on who you talk to, but I think when we look at the US RDA, which is the bare minimum, I think getting a little bit more than that makes sense. I think though, for diabetics, protein can be a problem because it can cause a rapid rise in blood glucose, relative to a more slow digesting food, which would be protein plus fat, which is how meat is typically packaged. And then you also remember protein powders are missing a lot of ingredients. It's not complete nutrition. You're taking care of that protein, but food is much more than just protein. There are,
it's a complete
interestingly,
package. It's a
choice.
Whether you want to have right.
Yeah, like for instance, we know that red meat contains something like 55,000 individual nutrients that, that's not in whey protein, So
that's not possible to incorporate in a whey protein, right?
Right. You might get 20 or 30 of those, but you're not going to get all 50,000. So it's
seriously. So fourth, is hypertension possible to cure through carnivore diet? Means like the way you exercise on a regular basis. What's your suggestion for the people, those who are actually suffering through hypertension and like this kind of problem issues with blood pressure?
Sure. I think, and there's different causes for hypertension, but the most common or the benign essential hypertension probably is associated with vascular inflammation. And so what I see very commonly, despite what people think about meat, it is a very non-inflammatory food. We see over and over again, people that eliminate all these other foods and just stick to meat see profound decreases in their overall inflammation status. And generally when that occurs, we see hypertension improve. So the vast majority of the people that do this do improve hypertension. I see, and this is sometimes problematic because if they're still on medication and their blood pressure is dropping naturally, sometimes those medications will bring them very low where they get dizzy, and sometimes they could potentially, pass out. So it's important to realize I should just make this caveat for if you're on medications, whether it's diabetes meds or hypertension meds or pain meds or meds for depression, you may need to adjust those down lower or even eliminate some of those when you switch diets. So it's important to realize and talk to your physician. Unfortunately, if you tell your physician, hey, I'm going to go on an all meat-based diet, many of them will tell you, no, don't do that.
Yes,
so you got to find
exactly.
somebody
That is what happens,
right?
especially means like if I see in my environment, when the people, those who are actually suffering through diabetes, they go to doctor, means unfortunately they come very disappointed, means like always they are actually trying to prescribe them insulin. They do not want their patients to get rid of the insulin or any kind of medication if they're suffering through hypertension, or means it's a big problem with the health professionals and this medical industry. Means even if the people want, they are actually not getting the support from their own personal physician, the doctors. They believe basically.
Yeah, I think it's unfortunate we've exported, some of our Western medicine. I mean, there's some good things about Western medicine. I'm not going to totally throw it under the bus because I practiced for years as a surgeon in that system, and I did a lot of good and helped a lot of people. But I think the way we manage chronic disease is, unfortunately, like you said, we panic when we see a condition, we throw a drug at it, we know that can change those symptoms, but we never sort of address the underlying cause. And so what we do is we make these people sort of dependent upon these drugs, and they over time, they have side effects that build up, they lose their efficacy, and it never makes the patient actually get healthy. You're just masking the symptoms for a while.
The vicious cycle just goes on. There is never,
correct.
It will be like a never ending process. So my next question, my fifth question is very much interesting. Is it possible to increase or maintain high testosterone levels of men naturally through a diet, especially after 30? Because if we get to see on the internet after 30 or after age of 30 plus, the testosterone level drops. So what do you think? Means like as a post that you do, and I've been observing you long, so I believe that you'll be answering this question smoothly, just like butter smooth.
Well, I think, first of all, it's interesting to sort of step away and think about why do we care about testosterone? And for women and men, women use testosterone too. Not that they don't have it to the extent that men do, but the function of testosterone, it keeps us. It has some mental benefits. It helps us to stay happy and cognitively sharp. As far as our physique goes, it helps us to stay lean, to keep muscle on. Of course, there's the roles it has in sex and reproduction. Those things are all important. So that's what we really want to know about. And when I talk about that function, the diet seems to help tremendously in that regard. Most people that go on this diet report improvements in libido, their sexual function, body composition, their mood, all those things that we would attribute to testosterone. Now, the interesting about testosterone, whether you're talking about total or free or bound testosterone, it still has to interact with a receptor, just like the insulin molecule has to interact with an insulin receptor, the thyroid hormone interacts with thyroid receptor. So it's not just how much hormone is there, it's how much hormone, how many receptors there are, how sensitive those receptors are. So I've seen the response be variable about the how much testosterone. What do I consistently see is improvements in the function of those hormones. And we can talk about why this happens with aging. I think it is a consequence of metabolic disease. I think it's just disease that's occurring. It's not that your testicles are no longer producing or your adrenal glands are no longer producing testosterone. Mm-hmm. It's just that as we take on metabolic damage, we become less efficient. There's interactions with insulin and testosterone. All the different hormones have a role to play there. But if you can stay lean and active and strong and do the lifestyle things and eat properly, you shouldn't need to supplement testosterone even into very old age. I think that's something that's, unfortunately, we don't have many people anymore that do what's necessary to stay active and stay physically fit and eat properly. It's the lifestyle, the sort of maladaptive lifestyle we have has led to this sort of epidemic of men that are suffering from the effects of poorly functioning or low levels of testosterone.
Right. So how much will you rate your diet for this kind of muscle mass you have and high intensity physical training that you perform on a regular basis?
Well, I think that, if we're talking about building or maintaining muscle, the number one thing there is the training part. That is the main absolute biggest driver of muscle mass. So you have to train, and you have to train correctly, and you have to train intelligently. So that's number one. Beyond that, protein becomes, from the dietary standpoint, protein probably becomes the most important macronutrient. Now, after that, we're looking at calories. And so one of the sort of problems that people run into with his diet, and we talked about this before for losing weight, is that it can be challenging to eat a lot of extra calories. And so when I want to actively put on muscle or gain mass, I literally have to eat well beyond satiety. I have to walk around stuffed and miserable, and and so I have to do that in order to gain weight. And many people struggle to do that. And it's, sometimes it's hard to get. For instance, for me, you're looking at something like 3 kilos of meat, a day, which is
right.
That's
I mean,
probably shocking
it's
to a
blow
lot
my
of people.
mind the way you eat and the way you work out. And it's like sometimes it's blow my mind. Basically, seriously.
Yeah, I mean, I regularly eat 2 kilos a day. That's my baseline standard amount. But I'm 6'5", 115 kilos or 113 kilos, something like that. So I'm not a small person, and I am very active, and I train very hard, and that's what I like to do. I like to compete. So I'm going to need more input than the average person.
Right. So next is it possible to solve hormonal imbalance of women like PCOS and ovarian cyst and early menopause through carnivore diet and physical exercise?
I think, yes, it's definitely possible. And again, I point to the fact that I've seen that happen many, many times. I've seen women come in showing me their cysts on ultrasound, and then they resolve, they go away, and their symptoms go away, and they lose weight, they feel better. And I think a lot of what drives polycystic ovarian syndrome is probably tied into something called hyperinsulinemia. So when our insulin levels are dysregulated or too high, then we see that occurring. And so we see that pretty regularly. We see fertility issues improve. I know that fertility, and even though there's a lot of people in India, there's problems with fertility right now. There's a lot of people having fertility issues and so on. I think that's related again to metabolic disease and diet. And so I do see women that have lots of problems with menstrual cycles clear up. I see PCOS go away. I see menopausal issues improve dramatically. So yeah, for sure. Absolutely.
Yeah. So it's very interesting. My next question. Animal protein or plant protein, which one is quality one and why?
Well, animal protein is, better aligned with what we need as far as ease at which you can access, the sort of quote unquote essential amino acids. And there's some indispensable ones, lysine, leucine, and some of the other ones that are harder, not impossible, but harder to get in plant products. And also they tend to be more calorie efficient. So to get the equivalent amount of actually bioavailable protein from a plant product, you have to tend to eat more food and more calories overall. So animal products are, clearly the winner in a number of ways. It's not to say you can't get protein from plant products, but it is more challenging, and many people just find that it's prohibitively challenging. It's not to say that no one can be successful with that. Now, you also have to remember things like soy, which is probably the most effective protein in the plant-based world, comes with things like trypsin inhibitors. So even though it has a lot of these nutrients, and particularly things like leucine, which is incredibly critical for muscle protein synthesis, it also has these things called trypsin inhibitors, which prevent the cleavage and breakdown of the peptides, which makes it harder to absorb. Anti-nutrients are pretty common in plant foods, and they tend to be absent in animal foods. And so that causes you to, not only do you have to eat more to get the right amounts of protein in the essential ones we need, you then have to overcome these anti-nutrients. And so you end up, eating a lot,
automatically absorption rate, becomes slower because of the plant proteins, anti-nutrients. And that is what actually doesn't happen in the animal protein section, right?
Well, as far as speed of absorption, I don't know if it's a speed issue. I think it's just the plant proteins, and are inhibited enough where they're not absorbed at all. So it doesn't matter. They just don't get absorbed. Some of them, and there's a lot of loss. And so what we'll see when people transition over to a carnivore-based diet is they won't make as much waste. They won't go to the bathroom as much. People talk about, they, instead of going to the bathroom 2 or 3 times a day, having bowel movements, they may only go once every 2 or 3 days. And that's completely fine and normal. And there's nothing wrong with that. It's because all the food you're eating is now being absorbed and not ending up in the latrine or down the toilet.
It's really interesting to hear this. It's really interesting to hear this. It's great. Means people actually have this conception, regarding this bowel movement. They think if they are pooping on a regular basis or 2 times in a day, that's completely fine. And if there is some issues with pooping, if they're not, having this bowel movement every day, or every alternate days, they think they are having some issues. This kind of conception that means they have in their mind.
Well, I mean, there's a reason for that, because if you're eating a diet that contains a lot of waste, a fiber-rich diet, you should be going to the bathroom a lot. And so if
Right.
you're not, then things are backed up. But if you're eating a diet that doesn't contain a lot of waste products, it's not containing fibers, and it's just meat-based, there's
Body
no
will
waste
absorb
building
properly.
up. You'll absorb everything properly, correct? So there is some truth to that. If you're eating a plant-based diet and you're not going to the bathroom for a couple of days, and you are having problems, because you're building up a lot of stuff in there.
Right, right.
But if you're on a meat-based diet, there's nothing building up because there's no waste. There's very little waste.
Very true, very scientific. So my next question is like, how important animal protein is for the overall muscle protein synthesis? Especially this question, goes for the people those who are actually so much focused into overall muscle building thing.
Yeah. So when we talk about, again, amino acids that trigger muscle protein synthesis, leucine tends to be one of the main drivers, although the other amino acids have to be present as well. But in the absence of leucine, you don't get stimulation of mTOR, which is called the mammalian target of rapamycin, which is essential for triggering muscle protein synthesis. Plant proteins just don't have leucine in very high quantities, so it's more challenging to get it that way. Even when you match, it's kind of interesting. There was a study came out last year that they actually took plant proteins and they took isolates of the different amino acids, and they took the same from animal proteins, and they fed them to people, and they watched the response on amino acid levels in the blood, and they saw that the plant proteins, even though they were identical, they only ended up showing about 40% less proteins made it into the bloodstream. So something's happening that's not causing them to be absorbed as easy. It's not to say you can't do it, but it's, again, far more challenging to do that.
Right. So is carnivore diet a healthy approach for the enhancement of the cognition function, the brain function?
Well, it depends who you talk to. There's many people that think I'm crazy and would say no, but no, I think we've seen that a lot of people will see improvements in cognition. We see there's a lot of studies out there looking at ketogenic diets, which a carnivore diet certainly can be and often is, that we've looked at studies that show improvements in cognition, particularly around elderly folks suffering from dementia or early dementia. We see significant improvement. That's been documented in the literature. Anecdotally, we see it all the time. People just claim better thought clarity. That, to make that claim fully, I think it needs to be tested more rigorously. But I would say I'm pretty confident that there is some benefit in that regard.
So in my next question, is it possible to gain every essential trace minerals and vitamins through the carnivore diet?
Yes, I definitely believe that's true. First of all, this is, again, you have to put some context in here. If you want to, hit the US RDA for, essential vitamins and minerals, you can do that on a carnivore diet. You can do it on a completely animal-based diet. Now, you might have to eat some organ meat. You might have to eat some seafood. You might have to include some dairy in that, but you can definitely make it, including vitamin C, which a lot of people point to. If you eat enough liver and pancreas and sweet, thymus, you've got a lot of vitamin C there. And meat, actually, the muscle actually does contain vitamin C, which people don't realize and are kind of surprised to find out. However, I don't even think you need to hit those RDA numbers in a lot of cases. And we're seeing that depending upon, remember we had this talk about anti-nutrients. We know, for instance, if you eat a lot of phytic acid, so you have a lot of phytic acid or phytates in things like beans and legumes and grains, and those things bind things. And so one thing they bind is zinc. Zinc, if you're eating a lot of phytic acid, if you're eating 1,000 milligrams of phytic acid today, which is not very much, that's 1 gram, you need to double your zinc intake. And if you're eating 2 grams of phytic acid, you need to triple your zinc intake. So we know that the baseline diet will affect the absorption of these other nutrients. And so when you're eating a diet that doesn't contain plants at all, you exclude all these anti-nutrients, we probably see a better efficiency with those things, and you don't need as many. And so things like magnesium deficiencies turning out to be extremely common. Well, magnesium is a cofactor in many aspects of carbohydrate metabolism. And so again, you may be utilizing more magnesium that way. We know that magnesium, again, is inhibited by fiber, inhibits it, oxalates inhibit it. These are all, compounds found in plants. And so, we just have more bioavailable, opportunities
Exactly.
for these nutrients, and
Right.
we probably need less of them as well.
Mm-hmm. We should understand the efficacy of the diet. Means like, as you said, in the plant-based diet or the excessive fibers that actually inhibits a lot of absorption of the trace minerals and all. But in case of the carnivore diet or the, it means meat-based diet, basically that actually doesn't happen. So automatically, the requirement, as you said, means like it becomes completely efficiently done by the body as we are actually consuming the real nutrition, the meat-based diet when we're actually doing it, right? So
Yeah, I think it's a pretty fair statement. Yeah, I think you're getting more bioavailable and you're needing less because you're not
right,
having it blocked by other things.
right. So last question. Does carnivore diet help in immunity boosting? Because people are so much into this right now after the COVID situation that immunity boosting, they are actually rushing for the supplements and there are a lot of things they're doing. So what do you think for this one?
Well, I think in general, health, a healthy person, a healthy system is going to enhance immunity. I don't think that's controversial at all. There are compounds found exclusively in meat that do have immune beneficial effects, things like carnosine and taurine and carnitine and creatine. All of those have been shown to enhance the immune system. So again, I can't say there's been a study out there that shows that people on this diet are going to be able to resist, an infection. It doesn't have to be coronavirus or COVID. It can be anything. There's all kinds of people out there. And we always see that the elderly, the metabolically frail, the people that have a lot of chronic disease always get sicker and they tend to die at a higher rate. So I think regardless of your belief on diet and nutrition, you should do something. That if you're overweight, if you're suffering from diabetes, you should be strongly focusing on that. And it's been really frustrating for me as a physician in the United States, and I suspect around the world, we're not emphasizing that. Instead of, and it's not there's any problem with telling people to wear a mask, but at the same time, you should tell these people, hey, you also need to be exercising. You need to put down the junk food, take care of your metabolic health, so you're not somebody that we're going to see in the hospital and fill up the hospital systems. And so, yes, I believe. The proper diet is an incredibly important part of this. And I would say a carnivore diet is extremely healthy. I think, other things, getting good sleep, getting out and getting some exercise, getting some sunlight, all those things are beneficial.
Right. Actually, people should actually focus on the overall nutrition paradigm, what we are actually consuming inside, because that is what actually defines our lifestyle. That is what you said. I mean, it's easy to understand, but still people do get confused about this. But it was really great conversation with you, Shawn. Means like I was actually expecting this kind of conversation, but it went really in a whole different level, and you answered every questions very smoothly without any kind of contradictory thoughts or like that, because that is what you are basically. Means I was expecting this kind of from you, and that is what you did. Thank you so much for this.
Well, again, thanks for the opportunity. I was thinking I have to laugh. I saw a movie, and I'm sure you're familiar. It was called Dangal. It was about a wrestler. I don't know if you saw that show. It was an Indian-made film.
Right.
One of the scenes there was he was trying to get his daughter stronger, and they said they have to eat chicken.
You have to eat protein, and you have to eat
You have to eat protein.
and
Yeah,
it,
so that
it
was
was a completely vegetarian family, so it was kind of fight situation for them. Yeah.
yeah.
So still in India, we have this kind of we actually mix up the religious value and the spirituality with science, and that is where the problem begins. We do not want to understand the efficacy or the importance of the real nutrition. That is what actually defines our overall lifestyle, and which can actually protect us from there are a lot of from morbidities, and there are a lot of other things, pathological situation. So that is very common in India. Means like, but still we have to keep fighting for this. We have to propagate this kind of information, and thanks to you for helping this this initiative, and to make our overall community more stronger by providing this information. It's really I believe that it will be helpful for a lot of people in India.
Yeah, I think that, when we're worried about, climate and environment and populations, I think healthy people are good for the environment. And so I think you need to be open-minded enough. We've got such access to information now. You may think it's not right for you, and that's fine. But if you're willing to try that, give it a go for 30 days, 60 days. And then just be open-minded enough to really look at the results and be honest with yourself. Look in the mirror. I'd say don't look at a research paper, look in the mirror, because that you can always, there's thousands of research papers. You can find research to support any belief that you want, but the mirror never lies. And so you look in the mirror, and I mean that both literally and figuratively. When you feel good and when things are
right.
working.
Then the feel good factor
yourself.
automatically happens. Exactly. That's very transparent statement.
Exactly.
Yes. Okay, Shawn, thank you so much for joining this Health Talks episode number 7, Carnivore Diet, and it went really, really, superb conversation, I believe. Thank you so much for joining this.
Perfect. Well, I hope you get a lot of folks to listen in.
Sure.
Make an impact. So.